Hello, and welcome. Today, we're diving into a less commonly known but potentially devastating condition affecting vision: ischemic optic neuropathy, or ION. This disease impacts the optic nerve, the vital cable connecting your eye to your brain. We'll explore what causes it, how it damages vision, and what can be done about it. Let's discuss what ignites this condition. Ischemic optic neuropathy, at its core, is caused by insufficient blood supply to the optic nerve. This lack of blood deprives the nerve of oxygen and nutrients, leading to damage. There are several risk factors that increase your chance of developing ION. These include conditions that affect blood vessels, such as high blood pressure, diabetes, high cholesterol, and heart disease. Certain medications, like amiodarone, have also been linked to increased risk. In some cases, especially with anterior ischemic optic neuropathy, no clear cause is identifiable. We refer to it as idiopathic. Now let's break down the how behind the damage. When blood flow to the optic nerve is compromised, the nerve cells, called neurons, become starved of oxygen. This oxygen deprivation, or ischemia, triggers a cascade of events. Neurons begin to malfunction and eventually die. The death of these nerve cells disrupts the transmission of visual information from the eye to the brain. Depending on the extent and location of the damage, different visual field defects can arise. In essence, it's like having a power outage in a specific part of the wiring that connects your eye to your brain. Ischemic optic neuropathy isn't an everyday diagnosis, but it's important to understand who is most vulnerable. The condition typically affects individuals over the age of 50, though it can occur in younger people. Anterior ischemic optic neuropathy, or AON, is more common than posterior ischemic optic neuropathy, or PO. It is also more common in Caucasians compared to other ethnic groups. While ION can affect anyone, those with pre-existing vascular risk factors, as mentioned earlier, are at significantly higher risk. The signs and symptoms of ischemic optic neuropathy can vary, but the most common and alarming symptom is sudden, painless vision loss in one eye. This vision loss can range from mild blurring to severe loss of sight. Other symptoms may include visual field defects, such as a loss of peripheral vision or a blind spot, and decreased color vision. Some patients also experience transient visual obscurations, brief periods of vision loss that come and go. It's important to note that IO usually affects only one eye initially, but the other eye can be affected later in some cases. Diagnosing ischemic optic neuropathy involves a thorough eye examination and a careful review of your medical history. Your eye doctor will assess your visual acuity, visual fields, and color vision. The optic nerve will be examined using an ophthalmoscope to look for swelling, paleness, or other abnormalities. Imaging tests such as optical coherence tomography, or OCT, can help visualize the optic nerve layers and detect subtle changes. Blood tests may be ordered to evaluate for underlying vascular risk factors. In some cases, a neuroimaging study like an MRI may be needed to rule out other conditions. While there aren't strict classifications for ION beyond the anterior and posterior designations we've already mentioned, it's helpful to understand these distinctions. Anterior ischemic optic neuropathy, or AION, involves damage to the front part of the optic nerve, close to the eye. Posterior ischemic optic neuropathy, or PIO, affects the portion of the optic nerve behind the eye, closer to the brain. GCA-AON is arteritic AION that is caused by giant cell arteritis and can be treated with steroids. Another classification can be based on the cause. Arteritic caused by inflammation of blood vessels, often from giant cell arteritis, and non-arteritic, where no specific inflammatory cause is found. Unfortunately, there is no proven cure for ischemic optic neuropathy. The primary goal of treatment is to manage underlying risk factors and prevent further vision loss. This may involve controlling blood pressure, blood sugar, and cholesterol levels through lifestyle changes and medications. In cases of arteritic ION, prompt treatment with high-dose corticosteroids is crucial to prevent further vision loss and involvement of the other eye. Low vision aids and rehabilitation can help patients adapt to their vision loss and maximize their remaining visual function. While there's no guaranteed way to prevent ischemic optic neuropathy, managing vascular risk factors is key. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can significantly reduce your risk. If you have conditions like high blood pressure, diabetes, or high cholesterol, work closely with your doctor to keep them well controlled. Regular eye exams are also crucial for early detection of any potential problems. The prognosis for ischemic optic neuropathy varies. In many cases, the initial vision loss is permanent, and there may be little or no improvement over time. However, some patients may experience some degree of recovery. The risk of developing ION in the other eye varies depending on the type. For non-arteritic AION, The risk of the second eye being affected is low, around 15%. However, arteritic ion as GCAI has very high risk of affecting the second eye, so it is important to treat the patient immediately. Recent research is focused on developing new treatments to protect the optic nerve and promote regeneration. Some promising avenues include the use of neuroprotective agents and stem cell therapy, but these are still in early stages of development. The best approach remains early detection and management of underlying risk factors to minimize the impact of this potentially devastating condition.